unfortunately, in many communities in America today, individuals who are facing a behavioral health emergency are having to use a system designed for medical emergency to meet their behavioral health care needs, which means that very often law enforcement, emergency departments, and often inpatient care have to be used when good crisis behavioral health care could resolve the crisis for the individual. So it's even more important that we as a community ensure that individuals who have a behavioral health crisis are not having to use the system designed to treat medical emergencies. So unfortunately, because most communities don't have well-developed crisis emergency response systems for individuals in a behavioral health crisis, and individuals are having to use that system developed for medical emergencies, police and emergency departments become a safety net for individuals in crisis. And that can be very, very difficult. If you think about it this way, if you're having a heart attack, individuals know what to do. We've been taught since we were small children that you call 911, that 911 comes out to see you, and that you're taken to an emergency department. It's not nearly as clear for someone who's having a behavioral health emergency. And unfortunately, the impact on individuals in crisis can be stigma. Individuals who are having a behavioral health emergency are just as much in danger as an individual who's having a medical crisis. But we don't have clear care pathways set up for them. I think it's really important that all of the players, whether it's the mobile crisis team or the crisis call center or emergency services, there are times when emergency services needs to be involved. We all need to work together to build relationships in the community so that we can serve as a safety net. I like to think of that as the relationships between the organizations that are serving people in crisis. The relationships between mobile crisis teams and crisis call centers, the relationships between law enforcement and emergency departments, everybody who has to work together to help an individual who might be in crisis. The stronger our relationships are, the stronger that safety net, so that individuals who are in crisis don't fall through the cracks of a system that's not prepared to serve them. When individuals have access to high quality care for behavioral health crises, it really can lead to getting people access to care very, very quickly in their moment of need, which is so very important, and other very positive outcomes. We see a reduction in arrests. We see a reduction in unnecessary hospitalizations. Mobile crisis in some communities has led to up to an 8% reduction in hospitalization. If you look at crisis call centers themselves, very often calls can be resolved on the phone. We've seen outcomes as amazing as 75% of calls being resolved at the point of that phone call without need for further intervention. If a mobile crisis team is actually deployed, we've seen that up to 80% of those individuals are able to receive care in the community without having to resort to higher levels of care. I would say if we can provide people access to responsive and compassionate care at the point of crisis, they'll be more likely to engage in services and less likely to be in crisis.